They like, oh, well, there's protocol and steps. Why we just can't tell them so they can go get him help? Because I can see it. Like, I don't know how they did.
Well, that's the thing. The help's not there. You know, everyone's so focused on mental health resources, medications, but they're not focused on the root of it all, which is diet. There's no one pushing diet as the way to heal. If they are, it's getting censored. And so that's why we're not seeing the big old change that we need to be seeing in our community, because it's not being showcased enough.
That is.
You know, I'll go to events, you know, and we're adults here, and cupcakes, chips, cookies. And I'm like, what are we doing eating this?
Yeah.
You know, where the fruit at? Where's the healthy options? But it's just the diets.
Yeah.
They got to be addressed. And you'll start seeing that, you know, after this conversation, just more and more in your day-to-day life, your kids' day-to-day life. You're like, you're going to see them eating something. You're like, you shouldn't be eating that.
Yeah,
you know, I shouldn't be eating this.
I definitely got to do better on that with my son. His mom, she eats healthy.
Whatever. Okay.
He don't. He's a 10-year-old boy. Chips, pizza, these Takis. I don't even. That's a whole. Yeah,
these Takis.
Yeah. That's disgusting. That's the worst.
Those are chemical heaven right there.
Yeah.
You know.
Yeah, because kids eat too much of those and get sick. We didn't eat too much of hot chips and we wasn't going.
That app I was telling you about, you can scan a bag of Takis.
Yeah.
The Yuka app, and it'll tell you causes autism, ADHD in children.
Wow. So I wonder though, because adults, well, I guess maybe the adults are eating them, but then here's another a thing. So when a kid gets to about 3, then you got to their 3, and then that's when you can get the help. That's when you can get all the counseling, all the ABA, all those different things. But once they hit 4, it's a whole different process. So it's like, if you're not paying attention, or if you're not thinking that your child has something wrong in the first 3 years, that's what set people back too. And I learned that because
you really can't tell. They 3. I mean, you can tell, but then at the same time you can't.
You're
still developing.
You can and you can't. Certain
you
kids,
think it's child's play.
You can't. But I think it's so much more of it nowadays. You can tell. Like I had a friend, and I didn't want to say nothing. But I'm like, I'm looking, I'm around because they got a couple kids, and I'm looking, I'm like, man, he's autistic. But I didn't want. It's hard to have those conversations.
Yes,
but
it is.
A conversation came up, and I was like, oh, good, thank you. I'm so glad, because I wanted to say something, but I didn't want to be rude, and found out he was, and now I can have a conversation because I used to work with life skills kids, so that's a whole different. Like, because it's more on boys than it is on girls. Like, it's crazy all the stuff that I learned about autism being in the classroom. But to what you're saying, and like actually paying attention to what the kids that I know that they're eating, you never really catch a lot of them, but it's texture too. You never really catch a lot of them eating healthy.
Yeah.
It's always bullcrap.
That's because the foods that they have been eating that's making them addicted. And they completely don't, their body's rejecting the stuff they're supposed to be having because they're just craving that other stuff.
This is mind-blowing because I've heard it, but to have like a conversation, and I know you know what you're talking about, and just to think about all the kids that I've dealt with that have had autism, and like, man, so is there, like, so say if somebody does, you might not know this answer, it just come to my brain.